What is facet joint injection or facet joint block, also called a medial branch block? There's a lot of confusion sometimes with these blocks because there's so many different names for them. Basically, what the facet joint is this joint in the back that we see moving. In between each vertebral body, there's a joint that connects them and allows you to bend forward, bend backwards, and twist. And you can get arthritis in these joints. These joints can cause that axial lower back pain, especially when you're leaning back or when you're twisting. So you come to the Cantor Spine Center, you're having some axial lower back pain. We might try some physical therapy first, maybe some anti-inflammatories. If that doesn't work, the next step will be what's called a medial branch block. And that medial branch block, the medial branch is a nerve that goes to this facet joint and is telling you have pain. So the first step we do is we go down and we block the nerves to the facet joint, those medial branch, with a little bit of steroid, but mostly numbing medication. We'll see you back 1 week after the procedure to see how you're doing. We will give you a diary. So the day of the procedure, you'll come in, we'll talk to our staff. You'll be here for about an hour total from door to door. The procedure itself only takes about 3 to 5 minutes. During the procedure, you'll be lying flat on the procedure table. We'll be using the x-ray machine to make sure we're right in that location we want to go to deliver that medication to block that nerve. We use very, very thin needles in order to get to that location. Once we get to that location, we put a little bit of contrast there to make sure it's right where we want it to be. Then we put the medicine in. We pull all the needles out, put a bandage on, you return to the recovery area. In the recovery area, we'll start asking you already, does your pain feel any better? You'll be able to move around, see if you're able to do a little bit more. Then you're going to keep track over the next week how your pain's been. You come back in a week and tell us how you did. If you received at least 80% relief from the injections, we'll repeat the injections one more time to see if you get that same 80% relief. Then if you do, we can go on to something that's a longer lasting relief called a radio frequency ablation. So an ablation or a rhizotomy is where we go down to those same nerves using the same type of needles, and instead of just injecting medicine to block those nerves to the facet joints, we burn the nerves or cauterize the nerves to disrupt that pain signal and stop the signal coming from these joints. A lot of people ask, well, if I don't feel the pain, am I going to do more damage? That's not true. This damage is slow. It takes years and years to result, arthritis buildup. What you will be able to do, though, since you don't have that pain, is you'll be able to regain your strength in your core and your lower back and actually stabilize this area so that when you do move and when you do bend and twist, it takes a lot of pressure off those facet joints. So these rhizotomies, like I said, very similar procedure to the medial branch blocks. You'll be, once again, on the procedure table lying down. We'll put the needles in the same spots, but instead of putting medicine through the needles, we put a little wire into each needle that connects to a device that'll heat up those wires, heat up just the little tips of the needles right where we want it to be, and it'll de-innervate or get rid of those nerves to the facet joint, thus giving you a lot of relief from that lower back pain, letting you get your life back, letting you get back to doing what you want to do.